Arthrogryposis Multiplex Congenita. Hi. Arthrogryposis multiplex congenita is a medical term of Greek origin that refers to a condition where the range of motion in various joints is limited, leading to stiffness and limited movement. Arthrogryposis multiplex congenita is not a specific diagnosis of any one disease, but is a clinical finding associated with more than 300 different diseases. First of all, let's talk about the causes and risk factors leading to arthrogryposis multiplex congenita. 1. Genetic factors. Gene mutations play an important role in arthrogryposis multiplex congenita, occurring spontaneously or being inherited from parents. The condition is genetically heterogeneous, meaning that different genetic mutations can lead to similar clinical manifestations. More than 35 specific genetic disorders, for example, spinal muscular atrophy type I, trisomy 18, have been associated with arthrogryposis multiplex congenita. 2. Environmental factors. Viral infections during pregnancy, such as rubella virus or Zika virus, are associated with an increased risk of arthrogryposis multiplex congenita. Additionally, insufficient fetal movement in the womb can contribute to joint contractures, possibly due to neurological or muscular abnormalities. According to research, any condition that hinders uterine movement for more than 3 consecutive weeks can lead to arthrogryposis multiplex congenita. However, limitations in fetal movement, such as due to uterine malformations, multiple pregnancies, or oligohydramnios, etc., cause impaired fetal movement syndrome. Furthermore, the mother's medical conditions can also lead to arthrogryposis multiplex congenita in the baby, such as multiple sclerosis, impaired uterine blood supply, etc. In addition, genetic abnormalities affecting the fetus, for example, neurological diseases, diseases of the muscles, including muscular dystrophy, connective tissue abnormalities, impaired fetal blood supply, anterior horn disease, etc., can also lead to arthrogryposis multiplex congenita in the child. So, how to recognize the symptoms and signs of arthrogryposis multiplex congenita? 1. Joint deformity. Arthrogryposis multiplex congenita typically affect joints including the shoulders, elbows, wrists, hips, knees, and ankles. Severity varies from case to case. Some people are affected in all limbs, while others may experience specific joint pain. Joint contractures often lead to a characteristic posture of the limbs, fixed in a bent or straightened position. 2. Muscle weakness. In addition to joint contractures, people with arthrogryposis multiplex congenita may experience muscle weakness, further worsening their ability to move and perform daily activities. And 3. Have facial deformities. Although primarily a limb-related condition, arthrogryposis multiplex congenita can sometimes also be associated with facial deformities, such as micrognathia or cleft palate. How is arthrogryposis multiplex congenita diagnosed and evaluated? In fact, arthrogryposis multiplex congenita are often diagnosed and evaluated using many different methods, such as clinical examination begins with a comprehensive health examination. Imaging diagnosis by X-ray and MRI. Then by genetic tests to find specific mutated genes related to arthrogryposis multiplex congenita. So, can arthrogryposis multiplex congenita be treated and with what methods? Although there is no cure for Arthrogryposis Multiplex Congenita, various treatments and interventions can help control symptoms and improve an individual's quality of life. 1. Physical therapy. Early and intensive physical therapy is the cornerstone of treatment, aiming to improve joint mobility, muscle strength, and overall functional ability. 2. Occupational therapy. Occupational therapy focuses on developing skills needed for activities of daily living such as dressing, feeding, and self-care. 3. Orthopedic interventions. In some cases, surgical procedures may be considered to relieve joint contractures and improve overall functional status. These interventions are often tailored to each individual's specific needs. 4. Braces. Orthopedic devices such as braces or splints may be prescribed to support and maintain proper joint position. And 5. Medical monitoring. Regular medical checkups are important to monitor the overall health of the individual and address any related complications or conditions. You need to know that the prognosis for congenital joint contractures is very different in each case, depending on the severity of joint damage and the effectiveness of intervention measures. With proper care, many people can also achieve a significant degree of independence. On the contrary, people with Arthrogryposis Multiplex Congenita also need to identify the huge challenges that follow throughout their lives. That is, ongoing medical care, adaptive devices, and potential surgical interventions may be needed throughout their lives. So, Arthrogryposis Multiplex Congenita is a complex condition with a multifaceted diagnostic and treatment approach. Advances in genetic research, early intervention, and comprehensive care contribute to improving the quality of life for people affected by Arthrogryposis Multiplex Congenita, helping them overcome the challenges associated with the condition, this rare congenital disorder. Wish you health. Thank you. Goodbye and see you again.